We're now joined by Dr. Nick Pyrsopoulos, who is medical director of the liver transplant program at University Hospital, and also James Guarrera, who is chief of service for surgery and surgical director of the liver transplantation initiative at University Hospital. Good to see you, gentlemen.
It's a pleasure. Thank you for having us.
So, one of the things that really strikes me is that your initiative around liver transplant, the scientific registry of transplant recipients, right? Distinguished because of what? Having to do with the 1-year survival rate of those who have received a transplant, because it seems to me to be incredible. Dr. Pyrsopoulos, take it first.
Excellent. Thank you very much. We're really very excited because this is excellence in patient care offered in the University Hospital by the whole team. And this signifies how important it is to care for these patients, not only during surgery, but after surgery as well. So our 1-year survival rate approaches 99%, which is the best in the country, and we're really very proud of this.
And what are we talking specifically about? Liver transplant?
Yes, sir. It's liver transplant.
So 98.7, right up there, I believe, with Harvard Medical School. It's right in the same range. So, Dr. Guerrero, let me ask you this. How many people are waiting for liver transplants as we speak right now? Because we work with the New Jersey Sharing Network on organ and tissue donation, and I'm just trying to get a sense of how serious this problem is.
In terms of transplant volume in the country, I mean, there are about between 8,000 or 9,000 liver transplants done in the country per year. And, the real crux of the problem we have is that the supply of donor organs really is really minuscule compared to the demand. We had approximately 40,000 deceased donor organs in the U.S. Last year, but in terms of waiting lists, there's large waiting lists. I don't have the today numbers for you, but as I tell my patients, it's for you and your family member. It's either 100% or 0%. So if you're on the list, you're all in waiting for that organ. And so the actual number, I don't know if Dr. P has a number of what the number is of the waiting list right now, but 8,000 to 9,000 liver transplants a year in the U.S. And in New Jersey, we average about 250 to 300 deceased donors. And then, of course, there's also living donors that can donate a part of their liver to a loved one or a friend or even a stranger. So the need is huge, and we really just need to draw attention to donation.
Dr. Pyrsopoulos, let me come back to you because your colleague is right. The number is 1. That one person waiting. And by the way, let's put this in perspective, Dr. Pyrsopoulos. What is it like for, I don't want to say the average patient because everyone's different, but what are most patients people waiting for a liver transplant? What are they facing? What's their life like?
The most important thing is extremely poor quality of life. Unfortunately, when the liver fails, there are significant consequences. One of them is mental issues and behavioral issues. People are not able to think straight. They have very short memory. And sometimes actually they cannot perform even simple things in life, like taking a phone call. Of course, drive is out of any concept. Besides that, they are very cachectic. They turn yellow. And this comes with a stigma as well. As you know, people with liver disease, everybody has been associated with alcohol-related issues. And of course, even if they don't suffer from something like this, they're afraid actually to get out in the community.
But I want to be clear, though. Hold on one second. So I want to be clear on something. My childhood idol growing up in baseball was Mickey Mantle. And Mickey Mantle, in fact, had a liver transplant, but he, in fact, spoke publicly about his alcoholism. Is it fair that the vast majority of people waiting for a liver are not there? I don't like to use the word alcoholics, but do not have issues with alcoholism.
So let's say alcohol-associated liver issues, which is something better than the alcoholic, this and that and the other, and try to label people. Yes, this is true. The vast majority actually of people now are patients with fatty liver disease. Our new way of lifestyle, such as sedentary life, diabetes, high cholesterol, hypertension. Lack of exercise, especially with the COVID situation right now, is inducing a number of fat in the liver, a number of fat content in the liver, and people develop scar tissue and subsequently cirrhosis. This is how our liver transplant waiting list is looking like nowadays.
I'm going to bring your colleague back in. Dr. Guarrera, your colleague mentioned COVID. The impact of COVID 14 months as we tape this program will be seen after on liver transplantation.
Yeah, I mean, there was definitely a huge impact in the Northeast, both for our program and the New York programs early on in the pandemic when the numbers were just astronomical and the hospitals were overwhelmed. The transplant programs, not only for liver transplant, but for other solid organs, really, first of all, there was just access to the OR, access to hospital, access to PPE. Those were all gigantic issues that really made it impossible to focus on such a, while a life-saving intervention like transplant is such a complex surgical intervention. So many programs had to pivot and try to do what we could to keep our patients that were sick and on the waiting list stable enough till the COVID settled down at some level. The other issue became that with such a high prevalence rate, we were concerned that a lot of the organ donors might have occult COVID. And then when we do a solid organ transplant, we give people immunosuppressive medicines that reduce their immune response. And so there were throughout the country many reports amongst transplant professionals of fresh transplant patients, because of all the immunosuppression, actually contracting COVID in the hospital because there was so much COVID going around the hospital. So I think all programs really had to take a cautious look and really reduce their transplant activity to just those that were really going to die otherwise if they couldn't have an immediate transplant.
Got about a minute and a half left. Let me do this. Research collaboration. Dr. P, I'm only saying that because your colleague called you that. Dr. Pyrsopoulos, real quick, research collaboration means what? And why is it so important? Real quick.
It is very important to have research actually within different departments and bring evolution in the new landscape of medication, surgical techniques, and donor potentials. In other words, maximizing the potential of donors by getting organs that they are not accepted otherwise, as they are considered marginal, so we can save more lives.
Dr. Pyrsopoulos, Dr. Guarrera, 98.7% survival rate. It's pretty amazing. So listen, people can find out more. 1 year survival rate, I want to be clear, correct? It's 1 year survival rate? Okay. And by the way, University Hospital with Dr. Sharif Elnahal, the former Commissioner, Department of Health, one of the institutions in healthcare that supports what we do. Doctors, thank you so much for joining us. We appreciate it and educating us.
Thanks so much for having us.
I'm Steve Adubato, and we thank you for your patience, for your being engaged, and frankly, being a part of what we do on every program. Thanks so much. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by NJM Insurance Group, PSC&G, New Jersey Sharing Network, the New Jersey Economic Development Authority, Bank of America, the New Jersey Board of Public Utilities Clean Energy Program, Summit Health, the New Jersey Education Association, and by the Healthcare Foundation of New Jersey. Promotional support provided by the New Jersey Business and Industry Association and by NJ Biz.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.